Goiter is one of the more prevalent medical conditions in the country. What are some of the things we should know to avoid or treat this disease? Joining us now is endocrinologist Dr. Cecilia Galang. Dr. Galang, great to have you with us on the program. Define for us, what is goiter?
Okay. Thank you for having me. Goiter is any abnormal growth or enlargement of the thyroid gland. The word goiter or bosyo in Filipino can refer to either nodular enlargement of the thyroid or a diffuse enlargement of the thyroid gland. So when we say nodular, we're referring to presence of lumps, bumps in the thyroid, which on ultrasound appear as radiologically distinct lesions from the rest of the thyroid, whereas diffuse goiter is a smoother, uniformly enlarged thyroid without these distinct nodules.
So Doc, what is the thyroid gland and what is its function in our body?
Okay, yes. So the thyroid gland, I'm sure maybe you've heard already, no? It's a butterfly-shaped organ that is located in the lower front of the neck. It functions to secrete thyroid hormones, no? Primarily T4 and to a lesser quantity T3. These thyroid hormones affect every cell of our body and performs life-sustaining functions, no? Like promoting normal fetal growth, childhood growth, brain development. It helps regulate our heart rate, temperature regulation. It also modulates body energy expenditure, weight, lipid metabolism. So it affects many cells in our body.
So basically, what causes goiter, Doc? And what are some of the initial symptoms?
Okay. So goiters can be associated with excess thyroid hormones, which we call hyperthyroidism, or a lack of thyroid hormones, which we call hypothyroidism. So when we talk about hyperthyroidism, symptoms could include tremors, palpitations, weight loss, and when goiters are associated with hyperthyroidism, we call these toxic goiters. Hypothyroidism, on the other hand, can present with cold intolerance, no, lamigin, constipation, tiredness, slowed thinking. In women, menstrual irregularities, no, such as heavy periods, dryness of skin, no. So goiters, causes of goiters could be, it can be sporadic, it can be due to autoimmune disease. For example, hyperthyroidism and a diffuse goiter can be caused by Graves' disease, which is an autoimmune disease. Also, non-toxic goiter. So the most common cause of non-toxic goiter worldwide is actually iodine deficiency. However, in developed countries, the most common cause of goiter, non-toxic goiter, would be Hashimoto's thyroiditis, which is also an autoimmune disease.
I hope you don't mind. I'd like to jump in. No, I'd like
with
Doc, I'd like to jump in.
Yes.
I want to find out, how can we prevent goiter? What should we not eat? And what are the treatments?
Okay. All right. So how do we prevent goiter? Of the different types of goiter, the only preventable type of goiter is goiter secondary to iodine deficiency. So this is the only preventable type of goiter. So iodine is very important in the production of thyroid hormones. Our thyroid gland needs iodine in order to produce adequate thyroid hormones. So when we have inadequate iodine intake, iodine is not produced by the body. We need to get it from the food that we eat.
Yes.
No? So when the thyroid does not have enough iodine, we can develop hypothyroidism and goiter.
So doctor, we have to eat more seafood, dairy products, and meat, right? Which is rich in iodine.
Exactly. Or seaweed, pwede rin.
Seaweed, fish, shellfish, milk, cheese, yogurt.
Yes.
Ayan.
Yes.
Thank you so much for joining us on The Final Word and for your advice. Endocrinologist Dr. Cecilia Galang.